For more on the President's prognosis, we're joined by Dr. Kelvin Sun. He's a clinical assistant professor in emergency medicine at Mount Sinai Health Systems in New York. Welcome to the show, Doctor.
Good to be back.
Hello. Well, we first found out the President has mild symptoms and then was feeling fatigued, and then a few hours later he's taken to hospital. What does that say to you as a physician?
This is the President we're talking about, who will have a very different experience from most patients that would go to the hospital. We caution for you to not go to the hospital until you absolutely have to. For most people, if you are short of breath, you need supplemental oxygen, you are suffering from silent hypoxia, things that need a hospital to take care of, things where you otherwise cannot get that kind of care at home, which is most people recover at home. If he were to go to the hospital and he received something called Regeneron, this drug cocktail by Regeneron, it is somewhat serious enough that it may warrant something that he cannot get or have it brought to him in the White House. But at the same time, it also could be, because he's the President, to be more precautious than anything else. And just an abundance of caution, he has his own private suite at Walter Reed. He's not in a hospital bed sharing with other patients. So he will get more care there in the way that you and I will not.
Right. I'm glad you brought up the antibody cocktail developed by biotech company Regeneron. It's not yet been approved as a treatment, though. So what do we know about the drug itself?
Let's just say that I do not have the privilege of ordering it from where I work in any of the places I work. I work at the majority of the healthcare systems in New York City. So pretty much every ER in New York I have access to. I've never seen this drug cocktail. I cannot order it. It's extremely experimental. The only way you can do it is you sign a lot of consent forms for a study. You are now a guinea pig. And for him to receive it, it does suggest there is some promise to it. Their preliminary results last week showed that people have improved, but not producing antibodies. However, notice that this drug cocktail does not include hydroxychloroquine. It's not part of the drug cocktail. It's just 2 antibodies to COVID-19.
Right. So what's the risk, just shifting topics a little bit, to the President's health? We know he's 74 and has a body mass index of over 30, which is clinically obese. Risk factors?
Extremely. He is the person that you do not want to have COVID-19 if you want him to have the highest chances of survival. There is a very reasonable chance to assume that he is now in the early stages. He now has symptoms. In the course of symptoms, with fatigue being one of them, especially with, I assume, high IL-6 levels, which usually are in high levels with people with high percentage of adipose tissue, aka adipose fat, and you're saying he's morbidly obese, you have to assume he has high IL-6 levels. Those are one of the markers that portends mortality. IL-6 is the one that gives you the highest chance to have a cytokine storm, when your body overreacts because of high IL-6 levels in your adipose tissue to kill you. And that is what we see in the majority of patients that died in March and April in New York City 2020.
But of course, we should add that the disease seems to affect individuals so differently. And as the President, as you say, he is probably getting the best level of care you can possibly get in this country.
Absolutely. I mean, everyone can be different. Like, the whole thing we can be certain about COVID-19 is that it's full of uncertainty. Anyone can have natural immunity versus unnatural, or just prone to having COVID-19. But the issue here is that people have different responses to COVID-19. Majority of it is some people are exposed to it and never get sick. And some people will get exposed to it and get sick really badly. The problem here is that he did get sick. He is sick. So it's not one of the majority of people who catch COVID and become asymptomatic carriers. He actually has symptoms. And now that he's now on that, he has to jump that ladder of the spectrum of possible badness.
Right. The President tested positive less than 24 hours ago, and only because a top 8 had tested positive. On Tuesday, he debated Joe Biden. Would he have been infectious then?
Yes. He probably would have been infectious even the 2 days before he tested positive. In the time where he had tested then, he would have been negative. It takes time from exposure to generate enough of a viral load to cause infection. And then after that is another time period in which infection becomes detectable in the PCR test, which he has. So if he's already been tested positive and he has symptoms, that's a high pretest probability, then you have to assume then that 3 to 4 days before that test, he had, whoever he's been exposed to also would have caught it. You have to wait another 3 to 4 days. So if they had tested today, they could have tested negative, but still are brewing a virus that they would have tested positive in 2 to 3 days. You have to test them every day if they have a high chance of exposure to someone that's a known positive and has symptoms that are correlated with a COVID-19 infection.
Right. Now, doctor, based on what we know about COVID-19, how long should President Trump stay in isolation? Because we're now just 30-odd days to Election Day, and this is the time when he would be out campaigning with people, close contact.
Yeah, CDC, which we have to assume, when I say CDC, I mean the CDC under this administration. So the CDC then is not the same as CDC now, recommends at least 10 days since the first positive test. Then you're no longer infectious. That's what they said. For me, as a personal individual, I would do 2 weeks at least. But as a healthcare worker, if you want to be absolutely 100% safe, no, do not pass go, it's 25 days.
Oh.
So it depends on how safe you want to be. Obviously, most people cannot survive doing 25 days of nothing, so it's all a practical concern.
Right. Well, Dr. Kelvinson, very good to speak with you. Thank you for your time.
Thank you.